actually. So depending on these factors, we will decide, okay, this is a best option for you to go, or, go for obedience training. Or if there's a dog who is excessively aggressive, then we have to train him to be less aggressive, or we do like aggression management, basically. So the question that you asked, yes, it does impact the training outcome. So for example, there are clients that I work with, and they're very dedicated towards their animal. In the sense, they give time, they give good food, they give good exercise, they spend time, and they're very much active when it comes to the training. But I also have to work with people who just want me to come and work, and they don't really want to participate. They ask their driver to participate, or they ask their gardener to participate. And what happens is, like, when you ask your staff to participate into the dog training, the outcome is very bad. Good results. And yes, there are people who have dogs for different motives. So when I decided to get a dog is because I wanted a companion. I wanted someone to live with me. There are people, yes, who actually buy a dog to guard a property. And there's nothing wrong with it, because if you see the history, dogs are supposed to be working. Those are like working breeds, right? And I think I would be very happy if my dog have some job to do rather than just sitting home full day doing nothing, right? So yes, depending on what motive you have taken the dog for, like could be guarding, could be just companionship. It just could be, there are a lot of people who ended up buying expensive breeds or different looking breeds just to show off, or because they see it on TV, or they see it on in their neighborhood, and they just want to have. And of course, they don't have any idea how to look after. The funnier part is like people having huskies in Kathmandu. I mean, it's like really funny. Why do we need a husky in Kathmandu? And they're supposed to be in the ice, right? But yeah, so this is one of the example of how humans actually act, and again, nothing can be done about it.
Yeah. Yes, ma'am. Due to preferences, the training also affects, and that's obvious too. And as there are community and adoption-based dogs in our society, and comparatively, they have different types of aggressions. And how have you dealt with them till date?
So you mean the pet dogs who have aggression issue?
Yes, pet dogs, and some are that community dogs, street dogs also. I think you have performed, or not street dogs.
To be honest, like making any stray animal less aggressive is very challenging, because when you are dealing with an animal who has no boundaries, and a lot of dogs on street who ended up having aggression thing is just because they are territorial. Territorial, it could be they had a bad experience in the past. It could be the aggression might have came from a gene. So maybe one of the parent was aggressive, and that's why the offspring is aggressive too. It can also be a learned behavior. So for example, let's say, because a stray dog, they always live in a pack. I'm sure you have noticed. So if if four other member of like dog being just agitated, or because this or because of that, but they only reach out to me or to other trainers, or maybe to the doctor, is when the dog actually attacked and bite. And I think this is the time when it's already too late. But in case of aggression, the dog, it doesn't come overnight. The dog starts showing all these signs from a very young age. It could be like from last 3 years, your dog is showing sign, but you missed all the sign. But when the dog ended up biting somebody or the kid or to you, and then you start thinking, oh my God, my dog is aggressive. So yeah, these are the signs that people should look to. Yeah.
So that means we can conclude that aggression varies according to sex, and many factors has many factors has been affected for the aggression, and they are behind the aggression. So we can conclude that sex, age, or any breed, and even from the small age, they end up being the aggression in the ultimate level. So we can conclude from this. Now, ma'am, I have a question regarding aggression too. During training sessions, have you ever given any medication in order to suppress the aggressiveness of dogs?
I found this question very funny, actually, because when I read this, I was like, oh God, from where this question came. The answer is no, because to be honest, for example, if I'm aggressive in nature, because humans are aggressive too in nature, it doesn't mean we bite, but we are aggressive too. But we don't have any medication that I can take a pill and then, I'll be okay. So likewise, I have never ever given any sort of drug, any sort of medication for any kind of behavior so far. But you might find it funny, or whoever, all the people that are with us, they might find it funny. A lot of people from medical field have actually suggested to put the dog down because the dog is being aggressive. Or they have also suggested to remove the canine or the teeth of the dog because they are being aggressive. And I think I found it to be, it's very absurd, because recently I got a call from one of the owner, and they were saying, like, we went to this particular doctor, and then the doctor said, remove the canine, even if the dog bite, it's not gonna hurt. And I was like, the dog is just a year old, and how you can do something of that sort where you actually remove the teeth. So I have never done it. I've never came across any trainer who has done it, but I know people who suggest to put down the dog, or to remove the canine, or to do weird sort of medical procedure to actually calm down the dog. But to be honest, none of these really work. It's just like a shortcut. Yeah.
Is there any most memorable moment for you to share with us?
I think I feel it with every dog, or every person that I work with, to be honest. Because when I work, as I said, like, I work with the owners and I work with the dog, and I always ended up being friends with my clients. Because if you are not friendly enough with your client, I think the communication will not be good enough. They will always have, you will always have like a communication gap if you are not friendly enough with your clients. No, I mean, they're funny incidents that happen every single day. And I think I enjoy my work so much. So I'm just blessed. That's what I can say. Every of them is pretty special. So I don't want to label one special. I mean, most of them are. Yeah.
Then for you, all are most special.
Yeah, but the funny part is, like, I remember all my bites very precisely. I had a lot of dog bites. Yeah, so that's what I really remember. Yeah, those are pretty special. Yeah.
I think you most often have to visit to veterinarians for exposure vaccines and all.
I'm not sure, but I have maybe you guys work as a veterinary. So what I've heard from a doctor, he was saying that putting like a rabies vaccination previously will not prevent you from rabies. That's what he mentioned, which means that every time you get a bite, it's important for you to go and get a rabies vaccination. But again, it can vary. If I get bitten from a dog who is not vaccinated in some way, or the owner has no idea, then yes, I have to go and get minimum 3 injections, if not 5. Yeah, so it's a thing.
Then I have seen in your video that you mentioned that Jake is so much lucky to have been around with many dogs. Then is there any difference between being alone for a dog and with other fellow companions? Can you highlight
it's a big difference, because if you go back to the history, and if you see animal in their natural form, because domesticating any animal is not natural, basically. We are doing it for our selfishness. Whether I get Jake or whether you get any dog, I mean, they're not supposed to be domesticated, first of all. But if you see, like, dogs are social animal, so they love to be in the pack. I mean, they love to work together. Whether you take a pack of a human and there is a dog, they're also very happy with it. Or whether you take a pack of 5 dogs and then there's my dog or your dog or any dog, I think they're very happy when they are with people or when they're with other dogs around. Yeah, for sure. Yeah.
Then what's your view on community dog welfare? Have you ever taken any steps for it?
Yes, because when I moved to Nepal, I did rescue a lot of stray dogs. And that was the point where I start noticing that there are a lot of pet dogs who suffer more than stray dogs, basically. And you might find it absurd I'm saying it, but I'm saying it because, for example, if there's any stray dog who's injured or who's sick, I can pick the dog without anyone's permission, and I can actually take care of the dog and bring him home and do whatever I want to do. But if you are one of the dog owner and I see you every single day abusing your own dog, not physically, but maybe you are putting your dog in cage 24 hours. But I won't really have the courage to go to you and tell you that, you can't do this to the dog. So yes, I mean that is one of the restriction that I face. So for me, to be honest, like not many people find it very interesting when I say it, but this is what I have to say. I cannot differentiate between dogs. For me, a stray dog is also a dog. A pet dog is also a dog. I mean, the only difference is like how some people are rich and how some people are poor. And how I can have certain things, how you can have certain things, but maybe the other person cannot have those. So, of course, for community dogs, they live with us, so it's our responsibility to take care of them. And I'm very happy that there are a lot of young people like all of you guys and a lot of like communities, a lot of organizations, they're coming forward and, working with the dogs, whether you are vaccinating them or whether you're neutering them or whether you take care of an injured animal. So yeah, this has been increasing. And what I do, my part is I can educate people, and I have trained a lot of Nepali dogs. And they are super, super intelligent. They are really amazing. Yeah. But a lot of people in Nepal think that Nepali dogs are not intelligent or a breed dog is more intelligent. But intelligence has nothing to do with the breed, to be honest. Of course, like traits can be different, but Nepali dogs are very super, super smart, basically. You can say that. Yeah.
Yes, regarding intelligence, I have also one such kind of question. Yes, in my locality there are many street dogs, and during while they see the people outside of my locality, they always bark, but they don't even bark off this. What is that? In that sense, that are they intelligent, or what kind of factor do they behave at that time? What kind of factor do they show?
I'm sorry, I didn't get the question. You mean they bark when somebody walks in the street?
Somebody walks by. Suppose, for example, this is my locality, and there are many street dogs, and they bark to the people who even passes by outside from my locality, but they don't even bark to us.
Oh, so I think it's again goes to the territorial, because dogs are basically territorial. So for example, if you have, let's say, 4 or 5 dogs who live particular in your street, they kind of take it as their responsibility to protect that. And whoever new person comes by, they see that individual or a dog as an invader, to be honest. And all they're doing is just they're informing you guys. I mean, it's kind of funny how they do it, but they're informing their people, like somebody's there. So, and this is very natural for them to do. Yeah.
Then, ma'am, is there any particular diet plan for day you would like to recommend?
Yes, I would like to talk about the diet, because if you noticed in last 5 to 6 years, the pet industry is being booming like crazy, and a lot of vets, a lot of people, a lot of pet breeders, they do recommend packed food, and I'm not against it, but I don't support it either, because I personally don't want to eat something out of a packet for the rest of my life if you see it. So like how the kind of a simple ratio that if I can share with all of you is like I give 30% of the carbs. So the carbs could be rice, like all of us does eat rice, and then the 40% or 50% is usually protein, which could be eggs, could be meat, could be different kind of organs, and the remaining thing could be fresh vegetables, which are boiled, or fruits. So I think this is a pretty good ratio that you can give to your dog. And one thing that I do is I look after, like, how can I give him some extra. So for example, my dog does eat peanut butter, which I make at home, because the the store-bought does have sugar and all that stuff. And I also give him chia seeds or like flax seeds and pumpkin seeds. And he eat a lot of fruits. He like eating those things. So I think adding a lot of natural food, which doesn't have spices or which doesn't have, artificial flavors and stuff like this, it's pretty good diet for dogs. Yeah, I think my dogs does eat better than I do. Yeah, I believe that. For sure.
Your favorite fruit is papaya.
Yeah, he eats like all sort of things. Yes.
And well, ma'am, as each dog psychology differs, so how do you understand such psychology before every training sessions and conduct the specific training? Is there a specific type of measures that you understand about the dog psychology? What kind of training do they need?
When you talk about dog psychology, it depends. Like a lot of behavior can be understood when you look at the body language of the dog. And you can learn a lot about body language of a dog when you start working with a lot of dogs. So you cannot work with one dog and then know all the dogs. The more dogs you come across, the more variation, the more depth. Like, and nowadays I can look at the owner and can say a lot about the dog. Or I can look at the dog and say a lot about the owner. And I'm like 90% time, I'm like really correct about it. Because like animals reflect our behavior. I mean, if you look at me and my dog, we are very similar. We are really, really similar. Because like he lives with me, he learns from me and I learn from him. Likewise, if you have a dog, I mean, you and your dog, if you guys are really, really close, then you realize that, okay, my dog do stuff like I do. not in literal way, but yes. So if whoever wants to work with dogs, I mean, the more dogs you come across, the more behavior you can understand, right? And as you mentioned, like how I decide which training a dog need is, again, we have to do a lot of discussion with the dog owner, that what exactly he's looking for, what kind of dog he wants his dog to become. And these are the few factors that will decide, okay, we can go for these particular things and we can go ahead with the training. Yeah.
Okay, then you have already gained idea that we are veterinarian students and related to that field, related to dog field. And as we veterinarian, though we are veterinarian, but we have no such kind of knowledge or relations regarding psychological factor of dogs.
Yeah.
Could you please highlight on how we would establish good communication with dogs while handling them?
I think I will be very happy to invite all of you to come by and to work with me or learn from me. I mean, I'd be more than happy. The reason that I'm saying this is because I change 9 different doctors for my dog. Yeah, it's a big number, and the reason why I'm saying this is I'm not shaming them or anything, but I did realize this reason that somehow nobody's teaching vet doctors how to deal with the dogs behaviorally. I mean, they know which medication to give. They know, how to treat the disease. They know how to talk to the people, but they don't really know what they're dealing with. I mean, literally, when you go to the vet, there are like 5 people. They're holding the dog. They're pushing the dog down, and it's such a extreme bad experience for a dog that the dog doesn't want to go back to the doctor. And I literally yelled at the people saying, like, what are you doing? My dog is sick and he's in pain, and they're like these 5 people, total strangers. My dog doesn't even know these people, and they're tying the mouth of a dog and pushing the dog down. I mean, even as a human, if I'm sick, I don't want like doctors coming and forcing me to take a medication. So yeah, as a vet or as whichever field that you are going to work in, it's super important that you know how to handle. I'm not even talking about the behavior. I'm just talking about dog handling, like how you can handle each dog, because every dog is different. You cannot apply the same formula, but they are basics. that you guys can learn. There are basics that every vet can learn, that how to interact with the dog. There are certain vets who are really good at it because it comes by their experience. They know that force doesn't really work. But there are also people that I've been with my dog or with other dogs. They think the only way to deal with an animal is by forcing it. And I think that's very sad. Yeah. So everyone should know how to do dog handling. Yeah.
Okay, then that's really sad of us, and we also don't know how to. Even in the vaccination case, we use modeling system, and we many 3 students we handle the dog like that, and we also don't know that. It's very sad, and we are not taught about that. And as you have already invited us, then that I would like to say to participants that you can, ma'am, where we can message if we are interested to deal with dogs with you.
So my office is at Tabakil actually, and if you can go to my Instagram or you can go on my Facebook page, and what I do, I'm going to organize a dog training thing for dog trainers basically. So I think when I say dog trainer, it does involve a lot of dog handling. If I'm a good trainer but I still don't know how to handle a dog, I will be like an awful dog trainer, right? So definitely, if any one of you will be interested, you can go through that, or you can see where I'll be posting like session, and you guys can message me there or message my team, and then we can go ahead and give you details of whichever session going on. Yeah.
Okay, then I think our participants have heard about that we can join with her in such type of trainings, and we can learn about handling. So dog handling for pet doctors, mainly for pet doctors, is so much important. For pet handling also, we can learn from her. So if you are interested in joining her training session, then you can message on her Facebook page or Instagram page. So, ma'am, I think this is in the verge of the end of the session. So we have a question from our participants. Binay Thapa. Binay Thapa would like to ask you: have you ever been for training any domestic feline? What are the experiences?
Can you guys hear me? Just a second. Yeah, just a second. Just a second. I'm sorry. Yeah. I did train a cat before, and I get a lot of scratches. It wasn't a very good experience, but it's like the dog bites and the cat scratch. So I'm not an expert when it comes to these animals, but not really. But like a few cats I've done. Yeah. Just like the domestic crazy cats. Yeah. Who just scratch my face. Nothing much. Yeah.
Okay. Now this is the end of our first session, and I would like to thank you so much, Ms. Abhilasha Sharma, for coming us and accepting our invitation. And we have learned many from you, and that I have heard about the quote that don't train dog, train the owner. By discussing with you, by talking with you, I have known that this is it. This quote is not just a is not just a bluff, but it is that don't train dogs but train owner too. And thank you so much for having thank you so much for being with us. And I would like to ask you a last question: what inspires you to be a dog trainer and behaviorist?
I think the very day I born, I had a dog at my house. So I remember like stealing puppies from like mothers from on the street, which is awful. I have stolen a lot of kittens when I was young, again. So it's like I've been always surrounded by animals, not only dogs or cat, but they were like all sort of animals where I used to live. And my mom was also an animal lover. So she was always like, tell me how to deal with the dogs or how to deal with animals. And she was a nature lover. So I think that somehow came from my mother. And of course, I never wanted to do a 9-to-5 job. So I ended up working with dogs. And yes, when I ended up having my own dog, who's Jake, so he did inspire me, and he I learned a lot from him basically. And whatever I've learned, I think I've learned from dogs. It's not something that I have do by myself. It just, when you work with animals, you learn a lot from them. So the everything goes. I'm very thankful that I get to do what I get to do. Yeah.
Thank you, ma'am. And sorry for taking you back. Mr. Joshi also have a query that though you have already foretold this about, but where can we have this training and how long will be its duration? He asked about this.
So I'm organizing this dog training session for November. So depends on, I think it probably will be like a 10-day session where you will be working with me for 4 to 5 hours a day, every single day. And we will be learning how to train with dogs, how to handle them, how to read them. So it's a really a big syllabus actually. And I would like to cover as much as I can. So it's best if you guys, if you like to know more about my work, or if you guys like to come and work with me, or come to join a session, then please, you can either go on Instagram or on Facebook, and my team, or if I'm there, I will answer all the questions that you guys have regarding it. Yeah.
Then, ma'am, have you some words about this program, and what have you expected, and what is your experience regarding this program?
I think I want to thank you, Usha, for being such an amazing person, and you being very, very helpful. Other than that, I would like to thank everybody, whoever joined, and they invested their time to listen what I have to say. And as I said, like I do come across a lot of amazing doctors who are really dedicated with what they do, and I do also come across people who are money oriented when it comes to animals, right? So I think there's always good and bad in every sector you go, but I think it's us who can decide what side we want to be at. And so I mean, as a doctor, people will trust all of you, and whatever you say, they will take it very seriously. So I think this is one of the power that you guys have. So it depends how you want to use that power, whether you really want to educate people or you want to just sell something. It depends, right? So yeah, all the best. And I'm very much happy that I get a chance to do it. And I hope I can see each one of you, maybe in future when you can come and work together. And I hope that we can expect an amazing doctors from all of you. So yeah, thank you so much.
Thank you, ma'am. And though it is personal, but I'm your big fan since I have watched you are our I have watched your videos multiple times. I would also like to meet you, and I hope I will meet you in future. Then thank you so much for coming us and making this first session successful.
Yeah, guys. Worries. Thank you, Usha. Thank you so much, and thank you everyone who has joined. Thank you very much. Yeah.
Now, everyone, I think you have gained much knowledge about the dog training and behavior and management. And if you have any queries, then you can ask ma'am through her Facebook pages or Instagram page. We will leave the page name and the link on the chat box. Now, let's move to second session. Our second session is the moderator of our second section is Mr. Anil Pokhrel, Treasurer of IVSA Paklihawa. He would be interviewing Mr. Tikaram Khanal, Dr. Tikaram Khanal, who will be speaking on the companion health topic. So over to you, Mr. Anil. Anil.
Thank you, Usha. Welcome everyone. Myself Anil Pokhrel, Treasurer of International Veterinary Student Association, IVSA Paklihawa. I am acting as a moderator for second most important part of our webinar, that is Companion Animal Health Assessment, which is going to be presented by Dr. Tikaram Khanal, who is currently working as a veterinary clinician at Valley Animal Clinic. If any questions comes in your mind regarding his presentation, you are free to put it on chat box. There is a Google form for feedback in the chat box. So I would like you all to fill the form and give your valuable feedback. Now I would like to hand over the floor to Dr. Tikaram Khanal, who will be presenting on companion animal health assessment.
Good afternoon, everyone. I am Dr. Tikaram Khanal, clinician at Veterinary Clinic, Kathmandu, and I am going to describe about how to check the health condition of companion animals. Companion animals means those animals which give us company. They are called pet animals. In Nepalese condition, the dog and cats are the most of the pet animals present on the main city of Nepal, just like Kathmandu, Pokhara, and more. So, as a veterinarian, it is very important nowadays, as globally, that the practitioners on pet animals are very interested and important nowadays. So, in Nepalese condition, it's a bit quite back about the condition of pet animals. So we are very back at their disease diagnosis, animal welfare conditions, but at least we can give as much we know the knowledge, as much we can give them the best animal health care people. So in the nowadays, everyone practitioners and most of the pet practitioners are have problems in these conditions, how we give them the best treatment, not only the treatment, but at the conditions that they easy to handle, easy to manage them. So it's very important to know about the animal welfare conditions. What is the main, only not the treatment of the disease, exactly diagnosis and treatment of the conditions which they come in clinic is not a major things, but we should give them in such a conditions they behave as a naturally. So animal welfare is come in first place. In animal welfare, we describe about the not only the physically, that means which we diagnose and which we plan for treatment of these conditions, not only the physically but also psychologically. That means how they behave in our clinics or which they came in our clinics, how they behave as naturally in the free environment conditions or say like feeling stress, some stress. So they must be psychologically, social and environmentally well-being. That means psychologically means they can adapt our conditions in our clinics. And social and environmental well-being means, social means they behave their natural, just like pawing, head shaking, that's their natural behavior. They are easy with us, not in a frightened conditions. So these things are very important in nowadays. And that's physically means, as we know, as a clinicians, as practitioners, we know the physically what they have changed, what is the main problems, but we also have the main things about their mental status, how they behave in our conditions. Is they feel good or become frightened, fear, it's very important. And their natural states means they have their natural status like feeding, urination, defecations in natural states like friendly manner. That's very important thing in treatment and diagnosis also, because if the animals are frightened and they have change in their physical appearance, so these things we need to be ascertained. That means if we give the best mental and natural status to them, we can correctly diagnose the problem. So there's in the slides there is if the animal is which came in our clinics, if they have to behave as like naturally friendly, they adapt to our clinical status or environment. That means they are coping with us, they have natural behaviors. If in our clinics they cannot be allowed to behave their natural behavior, that means they are in frustration stage, we do not allow to them to behave their natural status, that natural behavior. That means in frustration status, the animals is in frustration, and if we restrain them very hardly, then they are in the stress condition. If we have fear or anxiety, anything, but this condition must be clear in the correct diagnosis also. They have changed in the diagnostic approach also. So we must behave a natural environment condition, so they can behave, they can copy their natural conditions, just like friendly appearance, as feeding, they can feed with us, they have the feeding behavior and other expression behaviors, natural friendly manners. If they coping with us, and it's easy to diagnose the problem. If they cannot coping with us, and it's difficult to diagnose, because we can approach miscorrectly. We can judge the conditions wrongly to another cause. So there is a 5 animal welfare needs that must be in our attention. That means they have the suitable environment. The environment must be suitable for, just like we kept in a small cage. They have problem with, they not feel stress in a small space. They not have space for roaming or exercise, for feeding. They have little bit problem with feeding in other conditions. So we give a suitable environment with the thermocomfort temperature zones, and the need for suitable diets which must be given with the conditions, just like the puppy food, adult food, or their geriatrics. In case of renal disease, we need to change the diet, and we need to change their planning also for the water, how much volume we give them water, is orally or intravenously or enterally. That means it comes with our treatment plan also. We need to give the suitable diets, and how they behave, their natural behavior, normal behavior, just like sleeping, placing, pawning. That means all things are natural behavior. They behave or not, or they're in the frustration states or in the stress condition. They must be in some condition, just like we need to accompany with other dogs, just like if they are in non-solitude condition, if they are playing, just like puppies or kittens, they have in group conditions. So if we place them alone, they feel that depressed little bit and inactive. So in case of puppy, if we kept them together, they need to be healthy and they feel better in this condition. But in condition of the cat, they must be kept alone. If most of the adult cats, which are the frightened, or the cat and dogs cannot be put same together at one time, they may have some problems. So it depends upon the animals, as the history describes in which condition we put them. So if they are kept in alone or with a company, that matter. And that's the last things. With those 4 conditions which bring in our clinics, we need to give them after the physical examination, or what is the change, what is our diagnostic approach, how to correct them. So they must be free from the pain, suffering, and injury and the disease. It depends upon our condition. But not only the 5th point, the above the 4th points are also very important nowadays. So animal welfare, there is a 5 domain of the animal welfare in which must be kept in our mind, just like nutrition. Which nutrition we give, what kind of, according to their situation, just like in the growing condition or geriatric conditions, it depends upon their status. So in environment, we have to control, just like temperature, humidity, wind, all other things are in the environment. And health, the disease or injury, that depends upon our diagnostic approach, so how we give them treatment plan. And their behavior, how can they play with us or in their environment, we kept them. That's and the mental states, that means the very important. Just like we have some problem in the mental state, that means some are how to behave such the problems, how to diagnose them, is they are in stress condition, or in the frustration conditions, or in the anxiety or fear or frightens. That depends upon in their mental state. Just like when animals comes in our clinic, maybe they become very frightened, and just we have to going to wrong approach about this. As I'm also having the starting for this problem, just like the very angry, the aggressive dog, we feel he's very angry because this, but aggression is not his problem. It's a responsive stimuli for their fear. When they fear or frightens, they become aggressive. It's not a problem. Or in case of anxiety, they become aggressive. So aggressiveness nature is not only their response. They are for our treatment, but it is the conditions that which we gave them, but they became fear from our surrounding, or which gave them, so they become the aggressive. That's we need to care about this in the mental states. So yes, and how we measure our animal welfare, how we give them, and how can it measure it. That's in these slides we know about that. Just like we give an suitable environment, they become the happy, they coping with us, they become friends with us. That's how can we measure the welfare is right or wrong in this condition. Just like from what we give and what they respond about this, we can measure from this and these conditions, just like their housing and human-animal relationships. If we come closer with this, if they are frightened or come with us and play with us, how by this we can measure it. Environmental enrichments and veterinary care and nutrition, and which give the output just like become happy with us, psychologically active responses. That's an improved body condition score or muscle condition scores, that is by their nutrition and treatment hour. So by these measures we can measure the animal welfare conditions. Is it right or wrong? And the most important things for clinicians is the physical examination. Just I described above the slide that we can completely physically examine them, which is shown by externally or with help of aids of the instruments, certain instruments, just like thermometer, stethoscopes. By this we can measure the physical examination. But before the physically examine the animals, we need to care about their mental status, their psychological behavior in clinics and in their environment where they kept. If they are kept in very stressful conditions, and that may give the wrong diagnostic approach for blood, like changes in the blood parameters and other things, we need to care about this. Not only our clinic and their previous mental status and psychological behavior is also very important in case of the diagnostic approach. So it's very important and challenging skill to clinician physical examination. By this we can have very minor things that maybe go to the serious problems or any conditions that may change to serious, or before any just like surgical operation we need to examine the animals, or any diagnostic approach we need to examine the animal correctly. It's not matter how we fast go or slow, it doesn't matter, but we can't go to throw completely in any time, in any case, because every single notice is very important. So in case of physical examination, before going to the examination, we need to check that their history and their signal. That means that which breeds, which age, just like by asking the owner and in the friendly manner, not go through directly to the animals. Observe them from the distantly and go to the owner and talk to him. Then what is the problem, how they bring us, and not go directly to the problem they described. Go thoroughly on the examination, not approach so suddenly that you have the problem, because sometimes the main problem may be the cause of the other. We go through wrong. So before going any decision, we need to notice thoroughly. In similar, just like breeds is very important in breeds, just like you have the heavy breed, they have the more prone to the stomach upset, just like GDB, gastrointestinal and volvulus. So it's a breed specific. Most of the diseases are the breed specific. So we need to take care about the breeds, and we need to know how the disease is prone to. Because if we have this judgment on about the species, just like canine and feline, mostly companion animals, just like or the pets. In rabbits also, they come in clinic. So go detail thoroughly in every cases. Species, breed, age, sex, reproductive status, and other distinguishing characters. How we can check this, because in case of some pros name or this, how can they talk about their pets, just like any name or also. So go thoroughly and keep recording of all, and keep the history of their, how much they are, just like the nutritional status, reproductive status, how come they inherit, and know how they're feeding behavior, just like all things which will be our very important for the diagnostic approach. And their vaccination status, deworming status, and is on current medications or not, all things must be taken in history. And don't go thoroughly directly to the only judgment by the owner. Go thoroughly with the own experience also, just like this vaccination is complete, yes, and deworming is complete. So double check all things told by the owner, because sometimes they may sometimes given the wrong answer about the question. Just like if some owner gave them just like organophosphate poisoning cases, and they call, no, we don't have any poison in our home, so we don't use it. But the condition is you need to you need to ask them, yes, just like in this question, do you have any plantation in your garden or anything you have rice and you use any insecticide or not? And then they call yes, and then you have give the answer. Then if you talk directly to them, does it eat poisoning or organophosphatemia? Do you have? They call, no, doctor, they don't eat it. That's like, and then you need to double check every question. So history taking is also a very important thing. Go through the double check. And in the general appearance, that after the signalement and history taking, and go through the animals, just like the general appearance, and go through from the distantly, not to directly touch the animals. In some aggressive animals, they may get tempted. So go thoroughly and from the distance, and their general appearance. What is the general appearance? Their symmetry in the both in left and right sides, any masses or presence or not, how they are the postures and gaits, how about they are the mentation levels. And one of the important things is that in these topics, mentation of the level of consciousness, that means one thing that's here, we are then bright, alert and responsive. If they are the alert and responsive certain stimuli, just if you give hand and they want to licking it or not, that means they are the response with us. That means we are this very adult man. In puppy case, playful and active, we can give them how they're playful with us or not, or active or inactive. That means in case of puppy or kittens, if they are in the depressed conditions, they will be not any responsive. That if in hyperexcitability conditions or stupors, when they are in unconscious level before coma, and they after completely loss of consciousness, that in going coma, which is the condition, mental condition is there, is very important for the initial observation. And the hydration status, according to they are hydrated or dehydrated and severely dehydrated. By the skin tint, we can approach them. And just most of the time we need to check about the skin tint in the upper eyelid in case of the pet animals, because most upper eyelid is skin of the upper eyelid or the neck conditions, not must because some places of skin, just like above the shoulders, there's very high tinting because they are the flexible skin present in their parts. So we need to check in the upper eyelid skin, which give the exact hydration status of the animals. And orbits, eye orbits also, it is shrunken or flex, that is also help us hydration status. Okay. And after the general appearance, initial observation, we go to the vital signs. Just like in vital signs, why the body weight is there. Body weight is very important in dogs because less than 5 kg, less than around 5 pounds or less than 5 pounds and more than 75 pounds, that's what is the age, depending upon the age and their species and breeds. Just like small dog breeds, if they have the more than 20 kg, then they become obese. Just like if the heavy dog breeds, just like German Shepherd, if their body weight is less than 20 kg in adult case, they will become thin or their body condition score was very low. So body weight is also very important. And in case of temperature, we need to know about that. 100.5 to 102.5 degree Fahrenheit is in normal range. But in which situation we have to give the emergency treatment to the temperature according to our temperature, the body conditions. If the temperature is less than 99 or greater than 105, that means below the 99 and greater than 105 is heavy emergency conditions. So we need to treat according to their condition. Initially starting the treatment. So, but we sometimes when we are staining the animals, they become hyper-excitability and the temperature may increase up to 104.5. So in this condition, we need to rest them for certain time periods like 10 minutes, 15 minutes and taking the temperature again. If it goes to the normal range, then becomes it's not due to the some disease or condition, it's due to the excitation. So in the condition of the heart and pulse rates, in these conditions, you have to know about that. In normal situation, the heartbeat and pulse rate are in similar conditions. That means the heart rate and pulse rate are in the same range. So in dogs, 80 to 160, that means in a puppy, they are a little bit higher, 160 to up to 200 beats per minute we can call normal in case of the puppies and becomes a heavy dog which have the lower heart rate, and small dogs which have higher heart rate, that become the body weight in their breed size. And because of the feline, the cat is also a little bit higher than dog. And how we compare the pulse and heartbeat, that means if we compare the both, the heartbeat and pulse rate, if we compare them, if the heartbeat is so much higher and pulse rate is slow, that means the cardiac output is something wrong in cardiac output. There is a low pulse rate, that means we need to not pulse deficit conditions. In these conditions, we need to check what is the other condition, just like we need to check the other cardiac problems. There is some problems in the cardiac output which is not reached to the other systems. So we need to check care both heartbeat and pulse at the same times. Check when the heartbeat from both left and right side from the both, how we can auscultate the heart, we did describe about this. And the pulse rate from the femoral artery in dog and cat, we can check from the femoral artery the pulse, and we can compare the both heart rate and pulse rate, because this gives us some idea about it. And the respiratory rate and the character about this, and the respiration rate is also same as in the case of the puppy and the adult dogs, which is also in the dog about the 15 to 30 beats per respiration breath per minute, and on feline conditions 20 to 40 breath per minute. And by that, how we can measure the respiration rate, if we count from the externally by abdomen, also we can check the respiration rate. And if you count, then only count inspiration or expiration. If you count the only one things at a one time. If you count inspiration, then how much inspiration per 1 minute, that is the respiration rate. So doesn't confuse with the both count. In the auscultation, we have the sounds of inspiration and expiration also. So only the count at a one time, only one by this. And the perfusion indicators, it's very important things initially in the physical examination. What is the color of the perfusion indicator means the how the in the capillary blood supply is, how is it good or bad, what is the condition of the animal, just like the mucous membrane color in this condition, just like in anemic dogs or cat, it is very pale or whitish mucous membrane. So in this condition, what we do, the mucous membrane, we can need to check the other diagnostic approach for that. Is it problem in some conditions, or that it have the cardiac sound or any problems which have doesn't supply the blood to the capillary level, or tissue perfusion is very low, in which mucous membrane from the eye mucosa, oral mucosa, in case of the females we can check the vaginal mucosa also in these conditions. And the capillary refill times is very important. Capillary refill times in the peripheral tissue, just like in the oral mucosa, we can press the gum and leave it, in how much times it reappeared in the same condition as before the pressing the gums. So by this, if the capillary refill time is less than 2 seconds, in this normal in for the dogs, if it's greater than the 2 seconds, there is some problem in the cardiovascular, or they have the anemic conditions and other causes that must be diagnosis by other test or by the physician. Yes, and after that, the vital signs, we need to go through the systemic approach. Yes, the honor in history, we need to take what is the main problem, why the animal is bring to our clinic. We need to report it, but don't go thoroughly directly to the complaining, because I told you, sometimes if we go directly to the complaining, we may something missing it. We may go to the wrong diagnostic approach. So go thoroughly in all cases, in every cases, we need to take care about this. Yes, we have the emergency condition, just like the vomition or diarrhea, we need to correct it. Doesn't go through, don't anytime we need to go through thoroughly, but after correcting the problem, if we have some problem, then starting our treatment plan, we need to go thoroughly, because we have time to correct the direct complaining, but we need to go thoroughly to the animals, because every minor things may lead to the serious problem. So in our systemic approach, we start from the head and neck and observe from the distantly and closely to the animals. Does any have problem with symmetry in animals, or just like nasal discharge from the unilateral, bilateral nasal discharge or the ocular discharge. In these conditions, we can palpate, observe the things. We have problems in head and neck in some conditions. So in these conditions, we have to check in the head and neck condition. What are the things we need to be checking? Just like they are the sizes of, just like in head, if you check the eyes, and we have no any such instrument to check the other things. But what can we do with our observation? It's very important. Doesn't have become so pessimistic about we don't have, just like the just intraocular pressure. If we cannot measure it, tonometry with help of the, but if have some problem, so we can observe the things, because the every solution, we don't have the every diagnostic approach, so we increase our skills and increase our experience. So if we have done something wrong, then we learn from that mistakes, in which will help in the further cases, the before and after. So doesn't go thoroughly so much in case of pessimistic. We don't have such things. We cannot do it, that things. Do whatever you can. So in case of observe head and neck, in this case like eye, nasal discharge, and examine the oral cavity. For that, just like the one things I want to is that in case of the dogs, that the carnassial tooth abscess is very much problems in the adult dogs. In case of adult heavy treated adult dogs, in this carnassial teeth abscess. So in case of the upper premolar, fourth premolar teeth, which have the abscess, which is discharged from the below the eye level. So it's a peculiar character which I've seen in dogs. So that means that when you observe the things, that is presents or not. Just like in a problem, you can notice it. But if not the problem, you can know what is the normal. Their oral shape and size, how are the tongue conditions, gums condition, their dentation, determining the age. So go thoroughly with this. Just not for the problem, for only because it increases our skills. When you observe the normal, you can notice the abnormal by yourself. So in these cases, and observe the palpebral lymph nodes. That's in case of submandibular lymph nodes, it's very easy to palpate. Just below at the base of the neck, upper mandibles, lower mandibles, at the connection of the mandibles and neck, you can find it, the submandibular lymph node in dogs very easily. But in case of the salivary glands, also the palpebral, in which condition is present, they have just like the ranula, about psilocybe, it presents in the dog. It's also sometimes it needs to be corrected surgically. That means in salivary glands, or no, if you have any problem, if you palpate them naturally, then you can know that if problem is present, you can directly observe it. So try to palpate and observe the animals in normal condition, and which will help you for in abnormal conditions. And palpate the trachea. That is one of the diagnostic approach for the canal cough diagnosis. If you have the pressure on the trachea, it will cough in case of the canal cough. So you can know your diagnostic approach. If you have no other problems, you can directly tell them patients it have the canal cough. If in case of the pressure created in trachea, if it's coughing or not, what kind of cough, it's a dry hacking cough or moist cough. By this you can say yes, it is a condition of the canal cough or not in this condition. And after the head and neck, and you can go through the trunk and limbs. That means it's a body for that. Trunk and limbs, we can go through it. After, how can we measure the animals about this in cause condition? Just like here, the symmetry, masses, and tenderness. That means if their abnormal structure presents between left and right conditions, or any masses, or in the skins, or in muscles or bone, if their masses are present or not, it's about that. And they are the limbs and joints. It's very important. They are by their posture and gait, we can diagnose, we can help that it's problem in their walking or their gait condition. What is the very stiff or very playful conditions? It will be help us. Sometimes it's very difficult to diagnose the problem in the ligament, because we don't have such a diagnostic approach. Just like in case of we only have the radiography, X-ray, but by the X-ray it's very difficult, because in case of the ligament injury, we need to do MRI, or else just like, so arthroscopy is very important, but we don't have such a diagnostic plan. So we all about that's our experience. Sometimes we may go wrong, but if something is there is will wrong, we need to know about that. It is wrong, but it's okay. So sometimes it will be wrong, but you must be know about it. It's wrong or right. It will be help you for another case, which will be go through it. Yes, I have done this wrong in this case. That can I correct from another case. So it's very important to go through it. In case of the any skin, and after that assess all kisms, all in the limbs and pelvic region, palpate the pelvic regions, conformation and symmetry. It's all about it. When you go through it, when you observe through it, you will know about yourself, because it's not things after study, it's for the experience, observations, and you have to how much you carefully observe the animals. It depends on your observations, because good observations are good learner. In this case, if palpate the palpebral lymph node, all things are the same. You have to study and you have to observe the healthy animals. When you observe the healthy animal correctly, then you go through the disease animals with your experience. And in case of the thoracic cavity and thorax, we go through it by the conformations. If there have some protrusion in the left side, must be masses or some things that have difficulty, just like in case of the right side, some problems in the just like in emphysematous condition, right side emphysematous condition, they have problem in the respiration, they have the breath respiration, so we have to protrude these parts that physically from these observed externally. Also in this condition they have the difficulty in breathing patterns, so it may enlarge or it may engorged the these problems which have to get affected. So observed from their conformatory and the symmetry, and something masses externally presents just like tumors or not, that have. And one of the most important things in thoracic we have to go through physical examination is cardiac auscultation. It is very important to know about that. Sometimes we need to, it needs very skillful examination in case of the heartbeat. So by the heartbeat we have to auscultate it. We need to know some problems in it, because some in every condition we don't have electrocardiogram, so we have to do that, and you have problems. It's very difficult in case of our practice, and so we need to auscultate them. In such condition we need to go closely through it. I don't say that conformly go to the, we need to go that some problem in heart, just like problems, but we need to go closely through it. It's any conditions associated with it, or it is described by its sign or not, doesn't confirm the any condition by one diagnosis. I told you, just if you auscultate the heart sound, that means if you found its condition of the, just like if you some very feeble sound, heart sound, that means you cannot hear it, and so then you told, oh yes, this heart sound is very low, it's going to die. That you may be wrong. If the animal has very low sound, then it's directly related to the perfusion indicator or other condition, respiration distress, and use check the all things, not go through the only the one condition you have checked and you told that yes, this is the problem. Don't go through it, because you must know what is their outcome. If you find it, then what is their outcome? You must be notice it before telling the owner the problem. You must be go through the what is the outcome of this condition, and then you can certainly you can 100% sure that this is the problem. Just like in some conditions, just like in the cases of the thoracic effusion, in which the fluid is present in thoracic cavity, you have to problem with hearing the heart sound in this condition. So must be differentiated from the what is the problem in this condition. So what are the differential diagnosis for this condition, and what is the sign? If this is present, what is the sign that is present in dog or this dog or not? That's, and you have the 100% sure yes, it is present or not in this condition. So this will have, we have all know about the lob and dog conditions, in which conditions lob means, that means the larger sound and dog, but it's very difficult to separate it. Lob and dog sound, yes, this is lob and this is dog, because very gap, short period of gap between them. In this, at a one time we'll hear only one sound, because the is very low gap between them, and correctly observe it. Observe for the healthy animals. Try to differentiate. If you find it, and this will help you for the any alteration in the sound. That's in kind of the arrhythmia. This here is called the sinus arrhythmia, which is sinus arrhythmia. That is not, it's common in dogs. In case of sinus arrhythmia, more common in the dog, because in case of the inspiration, there is a heart rate is slightly increases, and in expiration there is a slightly decrease. This is not problem, it's a normal in case of the dogs. And there is any kinds of murmur sound, murmurs are present or not. Yes, this must be important. And there, yes, muffled sounds. That's my difficulty to hear is in sometimes we have here 3 to 4 sound in case of the gallop rhythm, so it's very difficult in which sound love and dog. As more than love and dog, it is found there is some problem in dog heart sounds which are physically examined in case of this. Yes, there is a point of maximum intensity in which place if we place our stethoscope which give the better sound. We need to know about that. That doesn't mean we need to know about this. We can check these conditions in case of the healthy animals and try to auscultate them, try to feel it, observe it, and we'll go through in this condition, just like even in which condition, just like in love and dog, in this condition, how we can go through in which place if we place the stethoscope, we give sound, it gives the better sound. If there is any problem with these valves or any sounds, we can observe by this. Yes, in case of the respiratory auscultation, yes, in which place left or right, it go through after the cardiac auscultation, the respiratory auscultation. In some cases, just like the panting or the respiratory distress, we are very difficult to hear the heart sound in this condition. So try to calm down the animals, calm down, and it's very easy to hear the sound after it becomes the animal very calm and easy. In case of the restraining, very stressful condition, it's very difficult to correctly approach through it. So in case of the respiratory auscultation, check for it just like the respiration rate. How is respiration rate? Very low, very fast, high rate, and this what is the depth? That means it's very shallow or depth. That is in case of the just like in case of the diaphragmatic hernia, in the case the animal cannot go through the depth in respiration. They come in the shallow respiration. We have problem with the very fast and shallow respiration. In case of the diaphragmatic hernia condition, we have the pain when there is a pain in the pleural effusion. In case of the pleural effusions, there is very shallow respiration is present because the painful condition in the depth respiration. So this is conditions. What is the depth of the respirations and what is the character of the respiration? There is very dry or sunlight feels like fluidy. What is this condition? Just like wheezes, sound comes from the small where rails, that means the dry sounds. What means heard about it, rhonchi, how speeches, wheezes, and this condition also are about the respirations character. What about their sounds? That means within conditions and by some sound characters, by their changes in some locations, just like the upper respiratory tract. If they have problem in the upper respiratory tracts, that presence of the railing sounds or other things that have the inspiratory problems or expiratory problems, that have the problem in the inspiration or the expiration, it gives idea about it. Where is the problems is present in there? Just like in case of the inspiratory problems, just like they have the nasal polyps or some things, they have the difficulty inspiration or they have difficulty in the expressions, expiratory, if you have to know about that. Yes, if they have both problems in their inspiration and expirations, that is the problem of the lung disease, just like in the pneumonic conditions. Okay. Yes. This is all about this condition as we described about this in this condition. So if we in the pets, there are some aggressive dogs, just like breeds having heavy breed dogs and aggressive natures, they have very stressful conditions. As I told you about their mental status, the aggressiveness is not a response how we behave, but it's their expression about their fear, anxiety. When they become fear or frightened, they become aggressiveness. They show the aggressiveness nature there. So that condition creates some problem, some changes in the blood parameters or any their physical examination. Just like in case of the stress, there's two mechanisms are involved in the stress. Just like one thing is the sympathetic nerve activation of the sympathetic nervous systems, which lead to secretion of the adrenalines or nephrine in the blood system, and which have the elevated the sympathetic nervous system, which increase our heart rate, temperature, respiration rate, all thing about this blood glucose, water activity level, sweating from paw pads and panting. This is all about that the activation of the sympathetic nervous system. And another system is approach in their conditions is that is hypothalamus, pituitary, and adrenal axis. That in this case, there the cortisol levels are increased and involves that the endocrine system is involved in this stressful condition, which is activated, and that by this hypothalamic, pituitary, adrenal axis in this condition, adrenal cortical cells are produce more cortisols, which leads to changes in which have the longer effect. That means sympathetic nervous systems has acutely active and it has shorter effect, but in case of the long stressful conditions, the hormonally activated the adrenal cortex and which secretes the cortisols, which changes in the conditions, just like the cortisol we know about, that's glucocorticoids, which are directly related to the blood glucose levels, which increase. And there is mineralocorticoids and sex corticoids, that reproduction status is decreased, and the mineralocorticoids and have the main things in which the stressful conditions, the cortisol levels are increased in blood, which give directly which give directly changes in the blood parameter. Just I told you, in case of the stress leukogram, all you know about that stress leukograms, in which if you calculate the condition, the dog is in stressful condition, if we check the blood parameter, we found the high neutrophilic conditions. That means the condition is not from the bacterial infection or the disease, maybe some in disease condition, just like in pyometra, or some condition is present. But if in condition is very stressful condition, the animal is present for a long time, it may change to our diagnostic plan. It may lead to the wrong way. So we need to check for it, stressful condition is present or not. In case of high cortisol level, which lead to the stress leukogram, that means high neutrophilic conditions with the lymphopenia, where the lymphocyte is very low conditions. In this case, there is presence of the monocytosis, may or may not be, but in case of the eosinophil also will decrease. And one thing very important in case of the cat, just like the excitation leads to the sympathetic nervous system activated, which activation of the sympathetic nervous system leads to the splenic contraction. That means in case of the cat, if we collect the blood in frightened dog, in frightened cat, not dog, in case of the cat, most of the cats, if we collect the blood in case of the frightened or the fear conditions, which leads to the splenic contraction, that excrete more blood cells in the vascular systems, which leads to the wrong blood parameters. That means which have the higher RBC counts, higher neutrophil counts, which leads to the wrong clinical output. So in condition of the stressful condition, let them calm, coping with our environment, coping with our clinical environment condition, and then collect the blood or other diagnostic approach in this condition. So does go through the hardly with them, because if you go through hardly, it's against the animal welfare and also lead us the wrong diagnosis of the animals. So in these conditions, go through all the animal welfare conditions must be, if we are going to provide clinical care, we must be go through all the things, what are their needs, what the animal needs. If we give them, the owner will be the happy, and it's also very benefit for the practice in our clinics in this condition. Go detailedly through the previous history, their signalement, and go detailedly through, double check every question, double check, not go thoroughly the owner. As they what described, just like in case of the condition, if you told this, you have your dog normal appetite with feeding, or you have the anorexia condition, they told, yes, he is very normal, he is in very normal condition in our home, and told them, and how much he eat, if he eat a egg today or not, if you told this, and then they ask, what is he eating about daily, what are their diet planning, then they describe us, yes, this is the condition. So go through always the double check the questions, don't go through the client any times and go through the correct physical examination as we can do. What are the approaches we have, what are the, and go through the diagnostic approach. If you have just like the general health checkup or the before, in one cases nowadays very common in the genetic profile. That means in case of the old age, above the 6 year or 7 years of the age. In case of the small dogs, we can take it from for like 7 to 8. In case of happy dog breeds, we can it's from 6 to 7 age. After the 6 and 7 years, genetic health profile. That means the renal function test and liver function test is very necessary to do before doing any diagnostic plan. Go through the blood examination, what are the needed, or go through the radiographic examination or the ultrasonography and all that, what we can do, and directly call to the owner that we need to check for this diagnostic approach. We don't have, but we can do this level. You are agree with us or not, and do your improve your skills this much, and what can you do thoroughly and go continuously go through. Not about the one day just you have learned, yes I know about it. Don't have so much. If you go thoroughly every day learning, if you have time spend with animals. I don't tell you only the companion animals, the domestic animals, ruminant. Spend time with them. You must be know the normal things. What are the present? Just like scat, anatomy, and other things. You need to go thoroughly, learning by own self. Not you not need to be with some diagnostic approaches. Just I want to do X-ray and do. Now before you go, if you feel it, observe it. I think one thing. Good observation is very important. If you observe very goodly, you can have very best clinicians in future practice. So don't go from one side of the view. Always go the multiple causes. What are the differential diagnoses? What are the conditions that may cause this condition? That may create this condition? Go through the differential diagnosis, making a plan. How to remove the differential diagnosis? What are the diagnostic approaches we have to do? And just like in case of the companion animals, they are the nowadays the owner have very supportive in case of the diagnostic approach, because there is no problem if you give them the best treatment, best diagnostic approaches, they are ready to pay many more age like human conditions. They are also ready to pay for their pet because they have kept them as a family member. So companion animals practice is very growing business in Nepalese condition also. Go thoroughly it. And I would like to welcome all the young practitioners which are going to be come out in this condition. So thank you so much.
Thank you, Dr. Tikaram Khanal, for the wonderful and informative presentation. Everyone must have gained something good from it.
Thank you.
The calming the animal and giving proper environment help in disease diagnosis. And
Yes.
first taking the history of animal, then observing it from distance, then only approaching it also help from preventing from the dog bites.
Yeah.
And also do not blindly believe on the owner's history. Also believe on your differential diagnostic approach, which will help in the proper diagnostic of the disease.
Yes.
Now if there are any questions regarding this presentation, please put it on the chat box. As please fill the feedback form which is available in the chat box. That will help us to improve our further webinars and other programs as well. As we have no further questions, I would like Dr. Tikaram Khanal to say a few words about today's webinars and about his experience with IVSA Paklihawa. Dr. Tikaram,
Yes.
please say about your experience about today's webinar and with the IVSA Paklihawa.
Yeah. Thank you for IVSA Paklihawa that give me some describe my experience. So it's very helpful to see, to observe, just like you young practitioners which are comes out after some periods. If you come in the practicing, if I'm very happy because if you go in practice in clinical cases and you have our share our knowledge about this, and when we study and we can practically imply it, we can become very happy in these cases. So I want to say that in every students or interning students and every practitioners go thoroughly it and apply all the knowledge, all the study matters that study every day study it's within the practical nature, practical manner. So describe it and they compare it from the animal to animals and not go through only. I just want to say about that not go through only the disease animals. Before you know the healthy, you can certainly describe, yes, it's become the animal is some problem, some have problems, so through it. So one in mind, you have to keep the what is the healthiness, what is the skin texture, just like in case of the pet, if you have no knowledge about the skin condition, it's that pretty specific. Just like in the, if you have checked the pork breeds, we have very coarse skins in this condition. Some in some just like species, and they have very soft skin coat in these conditions. So we need to know about the normal conditions, normal dog conditions. What is so go thoroughly it, not be so, and don't put your high demand or put your high expectation that I have studied that and I can't do anything. That doesn't matter. How you can use your study, it's matter. So I tell you, all the friends and juniors, brothers and sisters, that you go thoroughly and learning every day. The small efforts you have put in your career, it will be changed further in long term. So it will must be have fruitful in long terms. So be happy and do always your practical, increase your practical knowledge. Do always some such things that have impact in future. So fruitful, do always such things. I would like to say that. Thank you, Anil, and thank you, Abhilasha ma'am, for also giving us the dog training about that. Yes.
There is a question from Miss Abhilasha.
Yeah.
How they can reach you for the consultancy of their pets or animals?
Yes.
Provide.
In a clinician, as a veterinary clinician in Valley Animal Clinic, Koteshwar, yes, you can contact me directly or come in our clinic also. Yes, I am here for 24 hours in our clinic. So you can call me or just call in our clinic also.
Thank you, Dr. Tikaram Khanal, for your wonderful words, and your hard work on the presentation is seen by us.
Thank you.
Which was very fruitful and knowledge worthy. Now I would like to call Miss Usha Sharma, President of IVSA Paklihawa, to say few words and end today's webinar session.
Thank you, Anil. Am I audible?
Yes, you are.
Thank you so much. Respected speakers, guests, and all the participants. Today, dated October 4, 2020, International Veterinary Students Association, IVSA Paklihawa, conducted a webinar entitled Canine Companionship, Behavior Management and Clinical Care. Let me just give an overview why this day is celebrated. World Animal Day 2020 is celebrated to commemorate the importance of caring of animals, which signifies in terms of caring, protecting, and spreading awareness of the need to stop the curse of this year has entirely focused on the world of canines with the theme man and dog, which was designed globally. Today, for this, we had speakers. In the first session, we had Ms. Abhilasha Sharma, who is dog trainer and behaviorist. And in the second session, we had Dr. Tikaram Khanal. Dr. Tikaram Khanal is a veterinary clinician at Valley Animal Health Clinic. It is important to identify and know about the companion animal behaviors and psychology before proceeding towards any treatment protocols. Hence, keeping in view of this thing and the global theme, in which this World Animal Day is celebrated, in the first session, Ms. Abhilasha Sharma presented about the canine behavior, training, and everything associated with canines. And similarly, in the second session, Dr. Tikaram Khanal gave us overview in the detailed presentation about how to go from vital signs to systemic approach and oversee the stress which is occurred in animals. This was very informative, and I guess all the participants are benefited through this presentation and words from Abhilasha ma'am as well. And if you are interested to contact to any of this, then contact details. And they also have Facebook page, also the Instagram account. You can contact them through it. And at last, I would like to acknowledge Ms. Abhilasha Sharma and Dr. Tikaram Khanal, our speakers for today's session, who accepted our invitation to be part of this webinar despite of the short notice given to them. Similarly, I would also like to acknowledge my seniors who are always directing us since day one, and all my beloved juniors who are always supporting to us. And I'm thankful to all these energetic and dedicated committee members of IVSA Paklihawa who came up with this idea to conduct the webinar, which is obviously have been very influential to every people and have been a very learning opportunity to all of us. At last, I myself, Subhashri Sharma, the president of IVSA Paklihawa, would formally like to conclude the session for today. I hope you have a wonderful time. Have a nice day. Thank you. Abhilasha ma'am, we will give you the details of Dr. Tikaram Khanal through mail. Now I formally conclude this session for today. Everyone can leave this webinar. Thank you. Thank you for being here with us.